Thank you for joining us for part 2 of the CARES Act CDBG-CV long game session. In this session, we're going to talk a lot about ways that you could spend your CDBG-CV funds to prepare and prevent for future pandemics. With me today is William Roeder, Gary Causey, and Rich Hendershot. I'm Michelle Bush with Corporate Facts. We're a TA provider and a long-term community development consulting firm. And I'll turn it over quickly to Bill Roeder, who will introduce himself, and then Gary and Rich.
Thank you, Michelle. I'm Bill Roeder, formerly a HUD field office person. I was with HUD in the field for 38 years. And I concluded my career as the CPD director in Kansas City. So I spent my whole time working with grant recipients at the local level. And then I started doing consulting work with Corporate Facts after I retired back in about 2007 and have been doing it ever since. So my principal focus is on CPD programs administered by HUD. Gary?
Hello, my name is Gary Causey. Like Bill, I worked in the field office with HUD for my entire career. I was in the Jacksonville office and left there as a CPD director in 2017 after 29 years of service. And I've been working with Corporate Facts since I left HUD and continuing to enjoy the opportunity to speak with grantees and provide some technical assistance where needed. And glad to be here today. Thanks, Rich.
Good afternoon, everyone. Rich Hendershot. Like Bill and Gary, I've worked, in this case, I worked in the Columbus CPD field office for 40 years, first 15 as a rep, and then the last 25 as a program manager, retired in 2019. Been with Corporate Facts since July of 2020, primarily working on the AAQ answers for Region 4, the Atlanta region. Glad to see everybody today.
Great. I'll turn it over to you, Bill.
Thank you, Michelle. We realize that I'm looking at the numbers now. We've got almost 300 people on this, so I assume many of you were here for part 1 of our session, and we want to cover a couple of things that we did there very briefly for those who were not participants in part 1. Our objectives today are to describe this CDBG COVID funding and specifically the notice that was issued on April 9th of 2020 that got things started, as well as the Federal Register that spelled out the more detailed rules. We want to discuss implementation and approved activities. And we pretty much covered that in part 1, but we'll touch on it also in part 2. Examine the progress and steps to resolve issues related to progress. I know many of you had issues with your program. We were encouraged earlier that maybe timeliness will not be the issue that it was not long ago, but it's still an issue. We want to review resources to assess overall performance, ways that you can improve the performance of your particular program. And then lastly, discussing planning for finishing the job, which requires us to refocus on those original COVID activities that were designed to deal with the crisis that we all faced, and maybe now begin to refocus on the other aspects of the program, which are using the money to prepare and prevent future issues of this nature related to COVID. So those are our basic learning objectives. Andrea? So our agenda. Just to walk through our broad agenda, we talk about the background, where we came from and where it all started. And I shared with everybody sort of the history of CDBG. And as I reflect on it, I think in the creation of CDBG, the things that stand out as being particularly important are particularly important in COVID. The incredible flexibility that it provides you in terms of the kinds of activities you can carry out. The fact that decisions are at the local level, where you know better than we do what you need to do to address your particular problem. So that was where we came from and where it all started. Program implementation, you're off and running, and we talked about some of the things that you need to be considering as you're administering your ongoing program. Evaluation time, did everything go as planned? I can't remember a case where everything goes as planned, at least for something as complex and as significant as this. Overall program, as you all know, the 3-year rule on timeliness has been lifted, but we still have the original 6-year 100% expenditure requirement in place. So you can't, as our Deputy Assistant Secretary said at HUD, you can't take your foot off the pedal. And then lastly, finishing the job, as I mentioned, refocusing on the issues of preparing and preventing, as well as those original issues we focused on when we were dealing with the crisis. Next slide. Okay, Gary, would you like to take this one?
Yes, will, Bill, thanks. As you know, many of our grantees utilize CDBG-CV funding for economic development activities, particularly to assist small businesses and micro enterprises. Primarily, the types of activities selected by our grantees across the country were chosen to stabilize business operations, to help businesses recover from losses, and serve as sort of a safety net for businesses located in or serving low and moderate income areas. Based on early expenditure and accomplishment reporting from HUD around this time last year, CDBG-CV assisted nearly 75,000 businesses. Recognizing that some parts of the country did a little more economic development than others based on need, that averages out to 1,500 businesses assisted in each state with COVID funding. So congratulations to all of you. That is a very difficult challenge. It's remarkable given the funding limitations and the other pressing needs and challenges often associated with funding economic development activities using CDBG funds, even considering the waivers that were included in the CV notice. So going back to our history, all of us have hopefully taken the basically CDBG coursework, and we know that 2 criteria must be met for every CDBG activity. And one is that every activity must be eligible, and the second part is it must meet a program national objective. The CDBG criteria added a 3rd requirement, and that was that all activities must demonstrate a tieback through preventing, preparing for, or responding to coronavirus. So the grantee best practice report, which if you haven't noticed or haven't seen it on the HUD Exchange, I would encourage you to do so. We have a link listed on the last slide to that. When they identified some examples of activities across the country that clearly could demonstrate a tieback, and also we wanted to show you the corresponding national objective associated with that activity. Some of these activities include like helping meet payroll to retain existing jobs and avoid further job losses, covering space rental costs, replenishing and maintaining inventory, paying recurring business expenses such as utilities and insurance costs, purchasing supplies to keep businesses open, assisting displaced workers by providing small startup capital loans to new businesses and create replacement jobs, helping with business expansions, changing business models, and finding new ways to run businesses, such as expanding a cafe or a restaurant, allowing for outdoor dining areas and increased capacity for takeout food services. Through coordination with other agencies administering COVID funding, such as Treasury or Commerce or SBA or EDA, there were businesses that you might be able to identify that did not receive assistance through those other programs. This might be an opportunity for you to go back and consider trying to assist those businesses that were unable to get other COVID assistance. These examples provide opportunities for communities that demonstrate a successful implementation of activities that demonstrated a hardship tieback to COVID, and those that meet the national objective of low moderate income. primarily all economic development activities do fall under the category of low and moderate income, either areas or jobs. So that was the national objective that almost exclusively applies to economic development. Back to you, Bill.
Thanks, Gary. Rich, you want to take the next one?
Sure, I'm going to talk about during the course of this public services, and then in a subsequent slide, some specific slides later on, some examples of public services looking forward and public facilities. But again, as the slide indicates, those, even though we're now 3 years into this, it's still eligible to use emergency rental mortgage utility assistance. Internet access has also been added to that for up to 6 months. Again, that's up to 6 months, where formerly it was 3 months. And equipment, I'm going to use the term equipment a lot in what I'm going to say here in the next little bit, because equipment is in and of itself is an eligible public service. You could go back to some of your agencies that you worked with before to provide some food distribution type equipment. And again, expand kitchen capacity. Going back to some agencies you worked with before, you could expand and do some creative things with some Meals on Wheels programs, some other things related to that. And as the last part of that indicates, some additional supplies. Those are all eligible. These would be eligible under the categories of either low mod clientele, limited clientele, or low mod area. We'll talk about that a little bit more. Some good references that you can go to for that to ensure that you're documenting those activities correctly. Bill?
Yes, next slide. Rich, you want to go?
Some more examples here. Again, we'll get into some of the best practice ideas later on, some specific job training opportunities for nurses and EMTs, some child care that could be coupled with that, retraining workers. They've lost jobs or had to change jobs because of COVID loss, because of job result. Looking at the possibility of doing under 211, 311 hotlines, most likely again under LMC or LMA. The mobile would be considered an eligible equipment purchase public service. Again, as we talked about in the first session, we touched on it here. This is the one time you have no cap, and this program's been around for 40 years, that being CDBG, but it's the only time there's no cap. So we've always encouraged grantees, take advantage of what might be a one-time opportunity to be creative and look into some public service opportunities.
Okay, next slide.
Public facility improvements again, and I'll touch on this, I think, again, but if you're not familiar with the public facility quick guide, that along with some of the examples in the best practices product that was produced last year that Gary mentioned are some great examples. Those looking in tandem provide some great examples as to what you can do creatively to prepare for. Again, we're focusing on the prepare for tieback, and there are 3 pages in the CDBG public facility improvement guide, and pages 4 through 6 and the examples, and there's a chart in there that provides you the prepare for tieback examples that I think you need to look at, and provide you some great examples of how to look again back at some agencies maybe you worked with before, senior centers, window replacements on other buildings, health facilities. You're preparing for the future, and this guide and those ideas in there give you the opportunity to do so. With regard to low mod objective, it could be area or limited clientele, most likely either one of those two. Bill?
And Rich, I might mention at this point something we talked about earlier. Those of you who have been with the program, the CDBG program, for a long time, there's a wealth of information out there, but when you're dealing with the basic eligibility national objectives requirements, We always refer people back to that guide to eligibility and national objectives for entitlement cities that's available on the HUD exchange. If you've never used that before, it's categorized by activity type, walks you through an explanation of what rules apply to that activity type, and then it's followed by a little chart that shows how to establish meeting a national objective, depending on the specific circumstances. So we would encourage everybody that's considering a new activity to refer to that long-standing HUD guide for eligibility and national objectives. Next slide. Rich?
Again, and this first thing starts to get into the broadband, and there is a specific guidebook on the broadband and what can be done. And, you know, there's services we could talk about broadband, but there's then the expansion of the facility portion, the improvement portion, which, as it indicates there, you have wiring, fiber optic cables, fixed equipment, such as receivers, distribution lines. Those would all be considered the public improvement portion. And then we'll mention a little bit later, there are some other aspects of that under the public service portion that are all eligible. Again, that guide is something you need to look at. It provides a lot of good information in there, again, to prepare for the future and resilience.
Okay, next slide. Okay, I don't think I've ever dealt with an entitlement city that didn't do some kind of housing related work with their regular CDBG program. And in most of those cases, they have some form of single family housing rehab. It might be full blown rehab, or it might be very abbreviated, but housing has been a significant part of most people's CDBG program from the outset. And we wanted to just point your attention to some of these things. In the case of making that tie back with your housing related work, keep in mind the issues that you're dealing with. You're dealing with a house that has poor HVAC system, poor ventilation, maybe a house that's had water issues that cause mold or other things that could contribute to making COVID even worse, or spreading the disease in some way. Those are the kinds of things that I think you want to emphasize with your CDBG-CV funding. Maybe even supplement your ongoing regular housing rehab program with some of these things that maybe you hadn't been able to fund previously. Single family homeowner rehab may require adding other resources for non-CV tiebacks. Again, if you're dealing with single family housing, the normal rule is that unit has to be occupied by a low and moderate income household. For individual single family homes, some of you may have heard of neighborhood revitalization strategies, where there's a change in that rule that allows you to do it differently. But for conventional CDBG, you want to make that tieback, and you want to meet a low mod income benefit requirement. It's basically making sure that the occupant of that home is a low and moderate income household. Basically, the same things apply to renter occupied housing. I would take a look at those units and see what issues in those units can be tied back to COVID. And in those cases, you can use your CDBG-CV funds again for low mod income benefit. And if you were participating in part one, you may recall we emphasize the fact that CDBG-CV funds are subject to the primary benefit 70% overall low mod benefit rule, just as your regular CDBG program is. So you can consider other things, but your primary emphasis has to be activities that principally benefit low and moderate income people. And then lastly, HVAC private owner rehab to increase inventory of available units. If you're like I am, I live in Kansas City, there are finding homes that are available that are in decent condition is a struggle. Our housing market is still a very hot market. And it might require some effort on your part to increase that inventory of available units by providing funding for some of these things that you feel are COVID related. So those are the issues I think you need to think about in terms of utilizing your CDBG-CV funds for for housing. Okay, next slide. So we got a basic question for you. Are you considering any new activities that are uncertain in terms of basic eligibility or meeting a national objective? If you do, this would be an opportunity to put it into the chat room or the Q&A, and we'll eventually have an opportunity at the end of the session to address those. But are you having any new activities and you're just not quite sure, does it meet basic eligibility, national objectives, and tieback requirements? If so, let us know and put it in the chat room or the Q&A. And let's wait just for a moment and let people do that.
Bill, do we want to stop and answer some of the questions now?
I think we can. I think we're going to have time. Have you got a couple?
Yeah, I've got a couple. It says, with the purchase of message boards to convey emergency information to the community be an allowable activity to prepare and prevent COVID-19.
Yes, I think so. Rich and Gary, you agree?
Absolutely. Yes.
Yes.
I would agree too. For the mobile, there's one about a mobile dentist office.
That's one of the best practices that we're going to mention a little bit. I think it's Fargo, North Dakota, did a mobile dental office. So yes, that'd be eligible.
It makes sense rather than going into a traditional dentist office situation, have a mobile office and take the service to the individuals.
So both the service being provided, the caregiver service costs, as well as the mobile unit itself would be considered under the public service category.
Yes, okay. Funding a skate park with a pump track. You might want to.
I will tell you, my initial reaction is yes, and I'll tell you why. Because I know that HUD has determined that funding open space and parks and recreation facilities is an eligible CDBG-CV activity because it enables people to get outdoors in situations where they're not in close contact with each other. So I would think a similar argument can be made for a situation like that. Do you all agree?
Yep, it's kind of touched on in the public facilities guide I mentioned a few minutes ago, where it talks about installation of a redesign of public sidewalks, for example, some other things related to some outdoor activities. Yes.
Bill, you might want to turn on your video.
Oh,
Okay, how about rehab building for housing? How about rehab building for housing resource center? I think they're asking, can you rehab a building to have it, turn it into a housing resource center?
I'm not sure. What would a housing resource center be? What will be the purpose of that? To help people find housing?
I don't know if it would just be housing. They could have a resource center to get access to essential information.
Sounds
I
like a
would
public, sounds like a public facility
Public
to me.
service, right?
Yep.
I think there's a legitimate tie back to COVID because helping people in that way helps relieve them from what might otherwise be a COVID dangerous situation, right?
Right.
Right.
Here's an interesting one. Backlog in court proceedings because of COVID closures has created overcrowding in the adult detention center. Are public facility improvements to prevent future spread prohibited?
No, that's permissible.
Well, that's encouraged.
In my view, it would be a very high priority activity
Yeah.
because I'm thinking of those situations that I'm aware of. Without some changes and improvements, those people are in a very hazardous situation, it seems to me.
I think this session is doing exactly what we were intending because there's a lot of great ideas. People are asking about ways to spend their CDBG-CV funding. Can the funds be used to replace bathroom fixtures with touchless fixtures?
Absolutely.
Yes.
That a little bit of from a non-healthcare person. I remember early on, the concern was that COVID could be spent or could be spread simply by touching a surface that someone else who was infected touched. I think science has shown that's less likely now, but not impossible. So I think you can make a clear-cut argument that doing that would help prevent the spread of not only COVID, but any other diseases that might exist.
What about a mental health service program where we use CV funds to cover materials? Would medication be considered eligible? I'm assuming that's what this is asking.
The medication itself, I'm not sure about that. Unless the medication itself is to help that individual deal with COVID-related issues, I think that would be a pretty hard tieback. What do you all think?
I agree. I think there's other ways to spend money COVID money to assist that activity short of actually paying for medicine.
I agree.
My initial thought.
But you can drop that on the Hoover board and we'll research it and provide you a more specific answer. Okay, we are considering purchasing an oxygen generator for a nonprofit to serve an area and population that is unique because of the geographic location. What national objectives can be used? How can we document the national objective?
First of all, I would always default to trying to find a way to show that it principally benefits low and moderate income people. And the first two things that come to mind are, one, can you go to the area that's served by this facility? And when you look at the census data related to that geographic area, is that area majority low mod? If it is, you've got a facility that principally serves low and moderate income people. And I think you could qualify as a low mod area benefit activity. The second would be a limited clientele approach, where in order to be served, you have to be someone who is low and moderate income or meets one of the presumed benefit categories that you see in the regs. Any thoughts on that?
Other than to reiterate what you said earlier, Bill, that the Guide to National Objective Compliance and Eligibility Activities for Entitlement Communities guide, which is on the exchange, Chapter 3 provides, in an appendice to that, provides a lot of good guidance on how you determine LMA areas. It also provides the guidance on how you determine LMC, 5 different ways you can document LMC national objective. I would refer folks to that. That's kind of been the Bible for me over the years.
Agreed. I always tell people that of all the things you can do wrong with the CDBG program, the most significant is doing something that doesn't meet eligibility and national objectives. So I always tell them, make that determination using that handbook we mentioned earlier, and then make sure that determination is in your file. I would weld it to the inside of that file so it doesn't get away. So HUD knows that you made that determination based on established criteria. And that guide we mentioned is a great one.
It also seemed like that question pertained to purchasing equipment. And as Rich has mentioned earlier, that's eligible as well.
Yeah.
Okay, I'm getting a few messages that it's hard to hear me. Can you hear me now? Is that better with my headset on? Great.
Yes.
Okay. I think we should go on with the presentation and come back to the questions. We've only got, I think, we've got another half hour.
Agreed. Okay, well, I think we've got 45 minutes. My clock is not in front of me, but we go till 3:15 Eastern. I think so. Anyway, yeah, let's pick up where we left off. And Gary, I think you were going to talk about best practices for economic development.
Right. So in this portion of part 2, we're going to talk about some best practice ideas. And keep in mind, these generally came from the best practices report that was issued last summer. One of the activities that I mentioned earlier was an economic development activity where funds were used to expand cafes or restaurants so that might be able to resume or continue operations by addressing the challenges of social distancing. And one example of the best practices publication of how critical a small business is to the social and economic fabric and structure of a neighborhood that appeared was a case study of a family-owned restaurant in Aiken, South Carolina called What's Cooking. And by providing a CDBG-CV loan to cover rent and utilities, the owner of this formerly eat-in restaurant transformed the operation into what essentially became a takeout business. This avoided further losses of revenue, allowed for the retention of 15 full-time employees and 2 part-time staff, and increased their operations to the point where they were able to do 80% of their pre-pandemic business. Micro business support can be provided in a number of other ways to help businesses that continue to struggle to find their way back to pre-pandemic levels. General support, peer-to-peer support, and counseling can provide assistance to micro enterprises to connect business operations with a full range of guidance and available services from other places such as the SBA or executives who volunteer to help small businesses through AmeriCorps and Vista. Those can be especially helpful for new startup businesses. Child care services can permit mothers and parents of young children to enter or remain in the workforce to allow for them to attend job training or retraining in new fields of interest. Transportation services can offer services to provide rides to work or to trade school or to training. Technical and training can also help with employee advancement, develop new skills, starting or expanding a new business. And then one that often gets overlooked is the renovation of commercial space, to reutilize abandoned or vacant properties suitable for investment and business expansion to create new job opportunities. If you're not already done so, as Rich mentioned in the toolkit at the HUD Exchange and the link listed below, there's a number of products that are good information and provide guidance on other economic development activities. And in particular, I want to point out if you're in a rural area or a smaller urban county, there's some really, really great direction to help businesses in rural areas. Bill?
Yeah, I was going to mention that. I'm going to go off the top of my head here, but don't forget there's a separate provision in the eligibility section of the CDBG program that covers micro businesses. And as Gary pointed out, when you provide assistance to them, they're not subject to those public benefit rules that we talked about earlier. And help me if I recall, a micro business is a business, I think it's 5 or fewer employees, one of whom has to be the owner.
Mm-hmm. Correct.
Correct.
Is that right?
Yep.
Yes.
Okay. Next slide. Rich?
Back to me. So we touched on some of these, but the best practice, the one I think we need to talk about a little bit is the Yuma, Arizona case study, which is in the best practices guide. Back in midway through 2020, developed a program to provide child care for essential care health work, essential workers that were, on the front line of bad on the pandemic. And so that's proved to be a very successful program that out in Yuma. And we can now look at that as example too, as we want to use some public service funding for training nurses and EMTs now. And again, as I think I mentioned earlier, you could provide child care for them in conjunction with that. All those would be eligible. So your child care services in general for folks, child care services specific to those being trained, also receiving CV funding to do that. The trainers, those will all be eligible under this category. Again, I mentioned, I think earlier, the food banks, going back to your food banks, talking with them. Do they need additional equipment, freezers, refrigerators? Those are eligible. Expanding their current facility, maybe a new location. Again, youth services, the equipment that goes with that, whether it's recreational equipment, expanding their services, reimbursing them, as Bill talked about in the first session, the possibility they've maybe some costs that they incurred that they have not been reimbursed for that would be eligible for all those types of things would be something to consider. the healthcare, and the healthcare example is the mobile healthcare I mentioned a couple minutes ago of being eligible in Fargo. That's one of the best practices mentioned in the report, where they took their health and dental care and made it mobile to go to locations and individuals' homes. Wi-Fi, again, I mentioned the broadband guide. So Wi-Fi things such as digital literacy classes, telehealth, training to increase knowledge in broadband, and to increase knowledge of the using internet are all eligible under services. Purchase of laptops, hotspots for schools and senior centers, for example, would all be eligible. Equipment, public service costs. And then we mention the continued with emergency substance payments, including internet access, which initially was a question posed when COVID first started, whether internet access was ineligible for the 6 months subsistence payment. And the answer to that question is yes, and it is in the broadband guide. It's referenced there. So, next slide.
Rich, before we move on, I was just looking at this. We've talked about how using your CDBG-CV for COVID-related or coronavirus-related things can also help you with unknown future issues, health and otherwise. This is a perfect example of that. I mean, this is going to provide a lot of benefits to your community that go way beyond just CV issues, right?
Correct.
Okay, next slide.
Some more specific examples on your public facility improvements. We touched on them a little bit earlier. Again, all this is forward thinking, all to prepare for this. The tieback examples in these guides speak to these examples on this slide. Again, all those that are eligible public facility improvements could all be tied to preparing for another pandemic. Again, all eligible and, could be significant expenditures of funds. And now that we have the 6th year, you may have an opportunity to look at a larger expenditure that you wouldn't have had time to get under contract. Maybe an opportunity to look at some of those things under this. Again, back to the food bank expansion, both the expansion of the buildings itself, purchase of a new building and expansion would be under public facility, versus the purchase of refrigeration equipment that would be considered, again, equipment as a public service. So you need to look at both of those things and determine which category it goes under, but each category would be eligible. And of course, homeless shelter expansion. And there is a best practice in the in that section under Middletown, New York. They rehabbed a city-owned building, as I mentioned up there. And they increased their services for that 30 people per night, and which was a total of 3,600 persons per season, which was a significant assistance to Middletown, New York. Next slide. This is the broadband discussion again. This would be on the infrastructure type improvements to support those things mentioned here, resilience and expansion. Again, looking forward to areas where broadband is still an issue, or increasing it in areas and access where it's not sufficient. And as that slide says, that I already mentioned, those softer costs are public services. The harder costs are as public facilities. Again, you're looking at either low moderate income area benefit or low moderate income limited clientele, and the various categories under that meet the national objective. And then non-congregate residential living facilities versus housing, as Bill had mentioned earlier.
Rich, can we talk about that broadband for a moment? As I first heard about this, I was surprised, but I gather expanding broadband does a couple of things related to COVID. One, it gives people an opportunity to get information without having to make physical contact with others. And secondly, it allows people to share information with folks easily, particularly in an emergency situation. Is that generally the concept that supports this broadband activity?
Yes. Again, both the hard costs and the soft costs, I would say, yes. And it's interesting how there's still a lot of areas in this country they're still not where they need to be with regard to broadband access. So here again is an opportunity to use these funds for that purpose, where some other funds are limited.
Very good. Next slide. Okay, let me just touch on some of the things that we're aware of in the area of affordable housing that I mentioned earlier. And don't forget, we're not just talking about home ownership. We're also possibly talking about rental housing, particularly in a situation like most of us face, where the rental housing market is still very, very tight. The obvious things that come to mind are lead-based paint. Pretty much everybody that I know that has some sort of housing rehab program deals with lead-based paint. And also an issue that's gotten to be even greater in recent years, a recognition of mold and mold abatement. So those are things that you would obviously want to think about. Window replacement, because a house that has poor windows probably has poor ventilation, poor circulation, maybe doesn't have the kind of heating in the winter that is necessary. Conversion of vacant public buildings to affordable housing. A number of really, really good examples of where communities have utilized their funds for that purpose. Again, in this housing market where housing in general is hard to find, but affordable housing is really hard to find. Addressing code violations. If your current program doesn't address all code violations, maybe it's just a weatherization type program or something of that ilk. This might be a good opportunity to rethink that and broaden your rehab program to include all code violations. As we mentioned earlier, broadband infrastructure for both single family and rental housing. Maybe in order to extend broadband, you have to provide some assistance for the infrastructure to be there in order to reach out to those low and moderate income neighborhoods and individuals. And then lastly, expanding affordable housing inventory. Dedicate privately owned units that are rehabbed with CDBG-CV to your local housing authority for their housing choice vouchers program. I think if you haven't already been working with your local housing authority, this is a particularly important time to reach out to them and make sure you've got that dialogue going to see how you might be able to help them in meeting their needs. Because the bottom line is we're all in this together, and we're all trying to accomplish the same basic things. Next slide. A couple of other things that have come up that may not automatically come to mind as affordable housing related activities. Water and sewer connections. If people are on a septic system, particularly a septic system that doesn't work very well, helping to become connected to public sewer facilities would be a big plus. Tap-in fees to get into municipal water that gives them a reliable and safer water supply. And then I've dealt with a number of communities where their water systems have gotten so aged and so compromised over time that what they really need is water line replacement and improvement. I remember one of our entitlement communities used their CDBG to reline existing water lines at low and moderate income neighborhoods with one of those high-tech systems. I remember going out and looking at it and thinking, this is amazing how they do this. But those are some of the things that I think that we wanted to mention to you that are related to affordable housing. And again, that HUD exchange, that CDBG-CV toolkit provides a lot of information in this regard that I think would be useful. Next slide. Okay, Michelle, Gary.
All right, this one is mine as well. We don't typically think of planning and admin as a best practice topic. However, we do know from experience that good planning often leads to good outcomes. So when we look at CDBG-CV planning from a prepare for lens, it might benefit grantees to focus more on neighborhood resiliency planning. Because again, what we're talking about is going forward and looking at the future and trying to prepare for a future pandemic. For many of you, this might be the right time to reevaluate given the recent relief provided by the extended expenditure timeframe. Not suggesting the slowing down, as the Deputy Assistant Secretary stated, but you might take this opportunity to evaluate projects from a more functional and environmental capacity building standpoint. Examples of neighborhood planning might be for the future to ensure better targeting of the public service activities that you undertook up to this point. You might reassess and identify the best locations for the most efficient siting of stand-up clinics, vaccination sites, and food distribution activities. Another idea would be to review and determine the most effective ways on how to partner with agencies to quickly ramp up emergency housing assistance in the event that's needed again. Also, you could conduct a study and identify your existing public facility inventory and identify those facilities that need to be expanded or could be expanded and certainly need upgrades such as the HVAC or other health-related systems. And as we mentioned over and over now, is plan and coordinate with your local broadband companies to further support opportunities to provide more distance learning, as well as telemedicine in the Lomont areas. And consider this time to reconvene with your consultation partners, going back to when you did your amended con plan. There was a list of people that you met with and agencies and nonprofits and other city or county departments. You might want to go back and study now the results of those activities, find new opportunities, and analyze what future needs should be considered with any remaining CDBG-CV funds. And there's one exception for states only who are permitted to provide CDBG-CV planning grants and training for new subrecipients. That only applies to those states who receive CDBG-CV funding. I'll turn it over to Michelle to talk about the administration side.
Okay, great. Thank you, Gary. And again, it's not necessarily a innovative idea, but these are ways and important ways that you could utilize your administrative funds, to pay, use CV to pay for your administrative funds. And I'm going to talk about two key areas where you could better utilize your administrative funds. One is recovery of your indirect costs. And then the other one is understanding the differences between activity delivery and administrative costs. So with respect to indirect costs, 2 CFR 200, which are the financial management regulations, allows for full cost recovery. And indirect costs are an important expense that your organization should be trying to recover. And there's two ways to recover indirect costs. One is through an indirect cost rate plan, which you'd have to submit to your cognizant agency and get approved before you could use it. But a more simpler way for those agencies that have smaller amounts of federal money that they're administering, up to $35 million per year, you can use a more simpler approach to recover your indirect costs called a de minimis rate. And it's a simple exercise of applying a 10% de minimis rate to eligible cost activities. And there's, you could go to 2 CFR 200 to learn which of those activities you could apply the 10% de minimis rate to. It's a very important concept for sustaining your overall organization and making sure you can receive full cost recovery. The second item I want to talk about is activity delivery versus administration. So for those of you who might be bumping up against your admin cap or recognizing that you got 6 full years to plan for your administrative activities, that would include all of your final reporting, closeout, evaluation, and all important monitoring of your subrecipients. So CPD Notice 1307 describes the differences between activity delivery versus administration. If you've got employees that are actually delivering the services or doing program management, those are actually activity delivery costs, not administration costs. And it doesn't bump up against a 20% cap. I'd also remind you that this is eligible for your subrecipients. So you should also be allowing your subrecipients to either use the 10% de minimis rate, or if they have an indirect cost plan and rate, they could use that as well. Again, not only is it a good way, an easy way to spend your CV funds, it's a way to shore up your operations and provide for long-term sustainability. And so with that, Bill, I'm going to go back to the questions. We've got about 40 questions. We'll try to answer as many of them as we can. And just a reminder, if we don't get to your question, please go to the Hoover site and drop your question in the discussion board and check back in a couple of days and we'll be responding to those questions.
Michelle,
Okay.
before we do that, can I emphasize something that you just talked about? Because I think you and I would agree it's a very common mistake that grant recipients make. For some reason, there's a default setting at the local level that says if it's a personnel cost, it's automatically an administrative and planning cost that counts against the cap. And what Michelle was reminding you of is that notice explains it in detail. That is not the case. The best example I can think of is a typical CDBG funded housing rehab program. The costs associated with designing the program as a whole, managing the program as a whole, yes, those are probably general admin and planning costs. But think of all of those costs you have where people are doing inspections, processing applications, doing work write-ups, cost estimates. Those are all activity delivery costs. They're charged to rehab, not to general admin and planning. And Michelle, I think we see that probably as much as anything we've dealt with as consultants over and over again, where people are unnecessarily charging costs to general admin and planning.
We find that quite often. And that CPD notice 1307 is well worth your read. It's a pretty long document, but there's a lot of really good information in there about how to use your CDBG funds to pay for administrative activities for your other programs as well, like HOPWA or ESG. But more importantly, it talks about why you don't necessarily have to charge all your personnel costs to your administrative cap. There's a great chart in the 1307 notice that describes the type of activity that you might be undertaking and whether it qualifies as admin or activity delivery costs. For those of you who are not familiar with that concept, that chart will be very, very useful to you.
Hey, Bill,
Okay.
Before you go to the questions, one thing I wanted to mention, I failed to mention, we're talking about emergency payments for mortgage and rental assistance as a public service. What I've found over doing a lot of the Q&As or AAQs over the last couple of years is many grantees qualify those. I mean, you're making a mortgage assistance payment to a client and they're requesting 1099s, W-2s, and 1040s as if it's a homeowner rehab program. Well, keep in mind, you're classifying it as a public service. So your LMC self-certification would be an adequate documentation for low mod benefit as opposed to requesting all those other documents. And again, I think that's something worth mentioning as you pursue additional emergency assistance. And maybe some of the other questions are going to kind of relate to that as well. So.
Very good. I'm looking at my clock and I think we've got roughly 20 minutes before we need to wrap it up. So I like the idea, Michelle. Let's deal with as many Q&As as we can.
Great. And will you turn your camera on for us, Bill?
Oh, okay. You want to look at me? Okay.
Yes, I do. Okay. I saw the suggestion of expanding capacity for 211 and 311. It's been suggested to do this for a 911 dispatch system. Would this qualify?
I would think so. Imagine a situation where we've got a COVID outbreak and there are people out there that can't access 911, particularly low and moderate income people. I would think doing that would be a perfectly okay activity. Anybody else got any thoughts on that?
Other than we agree with you, no.
Right.
I'm typing away, Bill.
Yeah, I think that makes a lot of sense. I cannot imagine a situation where people don't have access to 911, particularly in a situation like this.
Okay, next question. About the message boards to convey emergency information, can they be portable or do they have to be physically installed in a low mod area?
It's eligible regardless of which type you use. The question, I guess, becomes whether you can establish that it's low mod benefit.
Right.
And as long as you can show that, even if it's portable, it's something that's being utilized in the neighborhood that is majority low mod, I think you would be okay. But if you were using it in a low mod neighborhood and then you started using it citywide and the city as a whole is not majority low mod, then I think you'd have a hard time establishing that low mod benefit criteria. Any thoughts on that?
It always goes back to what's the service area for this activity? If you can
Yeah.
demonstrate, as you just said, a service area is low moderate income, regardless of whether it's a mobile message board or fixed, it would be eligible.
And I'm thinking there's no way for an activity like this to call it a limited clientele because anybody can access it.
All right.
Okay.
Okay, we'll come back and revisit this one again on the Hoover site, but some person put it in the chat. Our HUD rep said the 911 system was considered general government services, and so it would not be eligible.
That's
And
a
another one
difficult
said the expansion of 911 or 311 services is a governmental responsibility. So it would be considered general conduct of government. I'm not sure if that means it's
okay.
eligible or not.
I think what they're getting at is this. When you go to the eligibility act section of the CDBG regs, there's this long list of eligible activities, and then there's this relatively short list of activities that are ineligible. And one of those is general conduct of government. Now, normally, general conduct of government deals with things like a city hall, conducting an election, a local election, things of that sort. But I wouldn't go so far as to say that all activities that would normally be carried out at the local level are somehow considered general conduct of government activities. In other words, I would take a much broader view and say, this is a specific activity that is eligible, meets a national objective, and can be tied to COVID. But I'm not sure I completely understand the question. Any other thoughts on that?
I personally don't think it's a general conduct of government, and there is and I don't have it referenced. We could drop it in the chat at some point. There is some guidance that HUD provided years ago on 911, and it became a service area issue, not a eligibility public improvement issue. But I just don't recall exactly. But it was an LMA is how it would have to be, meet a natural objective, as I recall.
And
I
just
think
Go ahead.
we should do a little bit more research on that and answer it on the Hoover site.
Okay. Yep.
And just
great.
a word here. This was something that none of us had dealt with previously, and we've all tried to learn together as it evolves. As a friend of mine at HUD once said, we've been asked to take off in the airplane, and we're still trying to decide how to bolt down the engines. We're all learning this together, and those kinds of differences of opinion are not uncommon. So give us an opportunity to do some research in that other site. And then if you want to, go back to your HUD office and share that with them and see if that resolves the problem.
All right, here's the next one. Is the repair of equipment truck to pick up food for a food bank an eligible expense as a public service?
Yes.
Yes.
Everybody agree?
Yes.
If a building is assisted with CV funds as a COVID-19 and other health assistance and information center now, can it be used as something else in 5 years?
Let me think this through. Is that a change of use situation,
right.
folks?
Exactly, yes.
That you would need to look at the change in use section of the regulations, which I think is like 570.505. Don't quote me on that citation, but there is some discussion in that reg citation of what happens after 5 years if you change the use. If it's for another low mod eligible use, it might be okay. If it's for a totally ineligible use, there's discussion of a, repayment at the fair market value. But that's a reference you need to go to.
In the regular CDBG program, if I recall the way the change of use rules apply, you're right, Rich. There's a time frame, but let's say we're still within that time frame. They get to repay or reuse that facility, meaning if you reuse it for another eligible activity that meets a national objective, that's okay, right?
Correct.
Yes.
So I'm not sure whether there would be anything different for COVID. Are you forever bound to use it for a specific COVID-related purpose?
The
Or
question.
will there come a point where as long as you're using it for an eligible CDBG purpose that meets a national objective, you're okay? I haven't seen anything that discusses that.
Yeah, that question has primarily come up under ESG COVID, more likely, where they converted something to a homeless shelter, a temporary homeless shelter. And then, after COVID goes away, then what would it be used for? And generally your continuum of care might pick up that facility and its operational costs and things like that. So it would continue to be a homeless shelter.
And if all else fails in that situation, Gary, if for some reason they can't reuse it for an eligible purpose, they can always dispose of it at current fair market value, and then those funds go back into the program, right?
Right, it's program income. Yeah.
Okay.
Okay. Can micro enterprise funding be utilized to help LMI businesses start up who were unable to start their business during the pandemic? Does this fall under economic improvement for areas impacted by the pandemic and the resulting economic situation?
These are micro enterprise businesses that did not exist at the time of the pandemic. And the question is, can we use CV funds now to help them get started?
Let's think about like a restaurant. Maybe they were close to getting started, and then when the pandemic hit, they weren't able to open their business. Can we still help that restaurant today?
I would think you can, as long as you can make the connection, Michelle, that you just did.
You just did, correct. You made the connection back to the pandemic.
Yep.
There you go.
Or in the case of a business owner who was displaced from their job due to COVID and could not start the business that person wanted to start because of COVID, I would say yes in that regard as well.
Well, I just thought of another possibility. You've got a neighborhood served by this restaurant that, because of the COVID pandemic, lost a bunch of their restaurants. And this business is now going to help them get restaurant service that they otherwise lost. Does that make sense?
Yeah.
It's
Yes.
kind of a stretch, but I think it makes sense to me. Yeah.
Okay, are you seeing grantees trying to use CV funds towards new construction of housing in areas like rural areas, meeting LMI that don't have a lot of services available to prevent and respond to COVID-19, but helps alleviate overcrowding?
I'm not seeing a lot of that, and I will tell you why. I'm not saying that it's not permissible. It is permissible, but because of the time frame we're dealing with, that kind of program would take a long time to develop and expend funds. So I would caution people that you've got to look over your shoulder and say, does my program design include activities that are going to make it difficult for me to spend the funds in a timely manner?
And it's just a reminder that new construction can only be carried out with a CDBO.
Yeah,
Right.
I wanted to point out that Gloria just posted that, and hello, Gloria. Long time since we talked. But yes, new construction definitely can't be carried out unless it's done through a CBDO.
Right.
Okay,
Yeah.
great. Thank you, Gloria.
We haven't touched on the CBDO's community-based development organization option in the CDBG regs. But if you've never looked at that, it would serve you well to take some time and look at it, because CBDOs can do things that otherwise you normally cannot do with your program. So that's a really important provision in the program that everybody needs to be familiar with.
If you're fortunate enough to have home funds, you might want to look in that direction. And don't think this is the right time to talk about NRSAs, but that's also another option.
Right.
Okay, I am struggling with finding a tie back to CV for a new activity for an organization to provide TA to childcare businesses. What might be some examples? For example, what would the agency need to keep on record to demonstrate COVID tieback?
Let me think that through. By providing daycare, you're giving people a, let's call it COVID safer situation, so they can go back to work. I think that connection could be made, but I don't know of anybody who's actually doing that. Any thoughts?
I've been looking at this one. I didn't answer it because I didn't really have anything to suggest for the tieback.
Are you willing to have a, which some grantees are using, a tieback certification? That I lost my job. I'm under, I had to take a pay cut. I need these childcare services because it was affected by COVID, and I'm willing to sign this. In addition to my low mod self-certification for limited clientele, I'm also signing a document that says I'm affected by the pandemic. Is that something we'd consider as eligible, as sufficient documentation?
I think that makes sense.
Something we haven't mentioned is the possibility of throwing these questions in the AAQ, which we respond to regularly.
What is the long-term monitoring requirements of using CV funds to purchase equipment for food banks?
Well, the longer term monitoring requirements, I take it by that they're concerned that it'll be used for the food bank, and then at some point in the not too distant future, they discover that it's gone or it's being used for something separate. And in that case, I would put some sort of reasonable provision in that contract that says it must be continued to be used for this purpose for, I would think, 5 years.
Yeah, the useful life, I think, would be something you could define in that agreement, and that it would be monitored for the period that was determined to be the useful life. Yeah.
Part 200 may address this under disposition.
Yeah, on equipment particularly, because it does go into great detail about what the residual value is for certain equipment, like major computer purchases. And
it even gives a distinction, I think, in there between equipment and supplies, which grantees have found helpful.
Right.
So you're basically dealing with a depreciation schedule of some kind, right?
Right.
Okay.
Yeah. Exactly.
If a resident has been assisted with rent, mortgage, utility for 6 months and would like to reapply for assistance, will we be able to provide assistance for a later period?
Wow.
My thoughts
I assume that
is 6 months.
I'm trying to remember, there was maybe it was a Q&A that talked about, okay, I think it's a maximum 6 years total. I don't think it has to be 6
months.
consecutive, or 6 months.
Right.
I don't think it has to be 6 consecutive months. Am I right?
Right.
Right.
That's right.
There is a question in the AAQ on paying rental emergency assistance that talks about how the timing of that 6 months can be calculated. But I think once you've provided it 6 months, I don't believe you could provide another. Even if there's a break, I don't think you can provide any more.
I agree.
Yeah.
And that's forever?
Yep.
I believe so.
Okay. Parking structures are needed here, but previously have not been allowed with CDBG funds. Will building parking structures near public facilities be allowed? What would be the nexus?
Say that again, Michelle.
Parking structures are needed, but previously have not been allowed with CDBG. Would building parking structures near public facilities be allowed? What would be the nexus?
Well, if we're saying structure, like a actual building structure, I'm struggling with that. If it's a couple of parking, if it's a parking lot and there's X number of spots dedicated to handicap, for example, or seniors, there's a way to, pay for that, but that sounds, and then making a tieback sounds kind of like a stretch to me personally.
Yeah, and
And
I agree with Gloria that the PPR, the tieback, you'd have to be pretty creative to make that tieback.
And I agree with Gloria also. I saw the note.
Yep.
I think this would be a really tough stretch.
Yep.
I have a hard time meeting the PPR requirement, the tieback requirement.
I want to go back and read what Gloria wrote in there about the daycare. She says, with the daycare, the grantee will have to show that parents cannot work because there is a shortage of daycare services available because most of them were closed during the pandemic and were unable to reopen. The provision of new daycare facilities to meet the need for scarce childcare and allow parents to return to work may meet PPR.
I like that. Keep in mind that COVID caused a lot of dislocations in the workplace, in our economy in general. And things that are done to try to correct those dislocations, I think makes a lot of sense. So I agree with that completely.
If you fund broadband Wi-Fi, does that qualify as construction and trigger Davis-Bacon and related acts?
Well, Davis-Bacon applies to construction of $2,000 or more, if I recall. And if what you're talking about is having to construct physical facilities in order to create that broadband expansion, and it's more than $2,000, yeah, Davis-Bacon probably would apply. Keep in mind, Davis-Bacon does not apply to housing rehab, single family housing rehab, because we got that exemption many, many years ago. But if this is physical construction in order to accommodate the broadband expansion, and it's over that I think it's $2,000 that trips Davis-Bacon, then I would say, yeah, Davis-Bacon would apply.
Okay. Can client benefits, for example, a mortgage payment, be included in the modified total direct cost pool for calculating indirect de minimis rate? And the answer to that is no. So client benefits are not part of modified total direct costs.